Hey Mr. J, so this is the final video for AIM 3. We're going to be doing the lumbar spine and the cervical neck special tests. So for the duration of this video, Tyler, do I have consent to touch you?
Yes. Do I have consent to touch you throughout
Yes.
this duration as well? Thank you.
All right, so starting off with the cervical compression test, I'm going to be standing behind the patient while my patient is going to be sitting. And I am going to press down on the crown of my patient's head. A positive test for this would be the patient experiences pain or a reproductions of symptoms in the upper cervical spine, the upper extremity, or both. And then the pathology is the compression of facet joints and narrowing of the intervertebral foramen, resulting in pain.
Fun fact, I did feel the pain in the top of my head again. Okay, Mr. J, now we're on to the Sperling's test. So just like the compression test, but I'm gonna ask my patient to tilt his head a little bit. I'm gonna interlock my hands and put it on the top of his head. Make sure your neck is completely straight. There you go. And then I'm going to compress the top. And a positive test would be pain, reproduction, or symptoms of radiating down the patient's arm. And then implications or the pathology is that the nerve root is impinged by narrowing of the neural foramen.
All right, now we're on to the cervical distraction test. So I'm gonna have my patient lying supine on the table, and then I am going to stabilize by putting one hand under the head and one hand under the chin. You could put your hand on the forehead too, but it's just for personal preference. And I'm going to pull back like so. And this is to put the patient's cervical spine into a position of comfort, and a positive test would be that the patient's symptoms are relieved or reduced. And then the implications or pathology is the compression of cervical facet joints or stenosis of the neural foramina. So this test relieves that pain or compression.
How we doing, Mr. J? So I'm now going to be performing the vertebral artery test. So for this test, it should not be performed if there is a presence of cervical fracture, dislocation, or instability. Those need to be rolled out before you perform this test. So I'm going to ask my patient to lay supine. I'm going to bring his neck into extension right here, and then I'm going to rotate and ask him to keep his eyes open so I can monitor his pupils. We would hold this for 30 seconds, but for the sake of the video, I will only hold it for 5. Okay, and then we would perform it bilaterally as well. Okay, and then for a positive test, there would be dizziness, confusion, unilateral pupil changes, or nausea. And then for the pathology, it'd be occlusion of the cervical vertebral arteries.
All right, Mr. J, so now we are doing the shoulder abduction test. So I'm gonna have my patient seated on the table, and I'm gonna be in front of my patient. I'm gonna ask him if he can take his hand and put it on the top of his head so that it's resting on top of the head. And can you maintain that position for 30 seconds? All right, and then the positive test for this would be a decrease in the patient's symptoms secondary to decreased tension on the involved nerve root, and then the implications would be herniated disc or nerve root compression. All right, Mr. J, so now we're on to the Valsalva test, and the Valsalva test is a clinical test that assesses for nerve injuries or problems in the cervical spine by increasing intraspinal pressure. So I'm going to ask Tyler here to perform a Valsalva maneuver. So he's going to forcibly blow air against the closed airway. So whether he puts his hand up to his mouth or just closes his mouth, he just do it. So can you do that?
For video purposes, I will put my hand up so you can tell I'm not breathing out.
And then a positive test can indicate nerve compression, potentially from an intervertebral disc or other anatomical structures.
Okay, Mr. J, now we're going to do the brachial plexus traction test. So I'm going to ask my patient I'm going to take his head right here and take his shoulder here. I'm going to compress his shoulder and push his head away. Good. Okay, so for a positive test of this test is reproduction of pain and or paresthesia symptoms throughout the involved upper extremity. Implications or the pathology of this is brachial plexus neuropraxia, radiating pain on the side opposite of the lateral bending, so here, tension, stretching of the brachial plexus, and then radiating pain on the side towards the lateral bending, which would be here. That is a compression of the cervical nerve roots between two vertebrae.
All right, so now we're on to the Athens test. So I'm gonna have my patient sitting on the table and I'm going to check for the radial pulse. Okay, and then once I found the pulse, I'm going to take Tyler's arm, move it all the way back, and then I'm gonna have him look in my direction and take a deep breath in. Okay, and then the positive test would be the radial pulse disappears, or it's a reproduction of nerve symptoms. And the implications with this would be the subclavian artery is occluded between the anterior and middle scalene muscles and the pectoralis minor. All right, so now we're on to the Allen's test. So once again, I'm gonna have my patient sitting on the table, and I'm going to check for the radial pulse. And then for this test, I'm going to take Tyler's arm, I'm going to raise it back and above his head. I'm going to have him take a deep breath in and then look to his left away from me. I actually got a positive. So a positive test for this would be the radial pulse disappears or neurological symptoms are reproduced. And then the implications for this is the pectoralis minor muscles compressing the neurovascular bundle. And next up is the military brace test. So I'm gonna have my patient, I'm gonna actually have him stand up. And I'm going to, once again, check for the radial pulse. Okay, and then I'm gonna have Tyler take a deep breath in, pull his arm back, and then have him hyperextend his neck forward. And then a positive test for this would be that the radial pulse disappears, and then the implications is the subclavian arteries being blocked by the costoclavicular structures of the shoulder.
Hey, Mr. J, so now we're on to the ruse test. So it says to stand in front of your patient, but for the video purposes, I will stand to the side. So I'm gonna ask my patient to bring his shoulders to 90 and elbows to 90 degrees. And then I'm going to ask him to open and close his hands for 3 minutes, but for the purpose of this video, we will only do it 15 seconds. And go. Good. Okay, so a positive test would be the inability to maintain the testing position. And then another one would be a replication of sensory and or motor symptoms in the extremity. And then the pathology or the implications is the thoracic outlet syndrome of neurologic origin. Okay, Mr. J, so now we're on to the straight leg raising test. So I'm going to place my hand placement, I'll show you on this leg so you can see better, right here on top of his leg, and then the other hand right here below the ankle. But I'm on this side of the body so you can see. So I'm here, at the bottom of his ankle, and I'm going to raise his leg up, keeping his knee straight. Okay. And then so for this, a positive test would be the patient complains of pain or reproduction of symptoms before the end of the normal range of motion. And then the implications of the pathology is that the sciatic nerve is irritated or there is compression of that nerve.
All right, Mr. Day. So now we're on to the slump test. So I'm gonna have Tyler sitting upright on the table, and I'm gonna have him with his spine erect, and then I'm gonna have him slump down and put his chin to his chest. I'm gonna hold his chin down. Okay, and I'm going to push on his shoulder, and then I'm gonna push on his shoulder, or I'm gonna have his head neutral, and then I'm gonna push down on his shoulders. And then I'm gonna have him flex his head, and then I'm gonna have him extend his knee and dorsiflex his ankle. Let's look at the camera. That. And I'm gonna keep pressing down, applying pressure, and then I'm gonna ask him to extend his head all the way up. Okay. And then for this, a positive test would be sciatic pain or reproductions of other neurological symptoms. And then implication/pathology would be its impingement of the dural lining, spinal cord, or other nerve roots.
Okay, Mr. J, so now we're on to the femoral nerve stretch test. So for this, it says to lay on the side that is unaffected, but for purpose of the video, we're going to follow the book and place towels under the affected side, so most of his weight is on the unaffected side. So we're gonna ask my patient to lay here. I'm going to put pressure here to stabilize. I'm going to bring his leg up. Then I'm gonna place my hand under his knee, and I'm going to bring it up into flexion or extension. Good, okay. And so for this, a positive test would be pain is elicited in the anterior or lateral thigh. And the implication or pathology is nerve root impingement on L2, L3, or L4.
All right, Mr. Jason, now we're on to the quadrant test. So I'm gonna have my patient standing. I'm gonna be positioned behind him, and I'm gonna have him extend his lumbar all the way back. I'm gonna have him rotate to the affected side. I'm gonna be stabilizing his shoulders, like that. And then a positive test would be a reproduction of the patient's symptoms, and then the implications or pathology is radicular symptoms indicate compression of the intervertebral foramina that impinges on the lumbar nerve roots, and then lumbar pain indicates facet joint pathology, and then symptoms isolated to the area of the PSIS, which may also indicate SI joint dysfunction.
Okay, Mr. J, so now we're on to the stork test. So he's tall. So I'm gonna stand behind him. I'm going to have my hands on his shoulders. I'm gonna ask him to bring up one leg and then hyperextend his trunk. I will assist in this motion. Good. And then we perform on the other side as well. Good. Good. Okay. So for this, a positive test would be pain is noted in the lumbar spine or SI area. And then implications is shear forces are placed on the pars interarticularis by iliopsoas pulling the vertebra anteriorly, resulting in pain.
All right, Mr. J, now we're on to the Favors or Patrick's test. So I'm gonna have my patient laying flat, supine on the table. I'm gonna have his knee bent and overlapping his other leg. I'm gonna have my hand on the opposite ASIS, and then my other hand applying pressure on the knee. And I'm just going to be applying pressure downward, like so. And a positive test for this would be reproductions of symptoms in the sacroiliac joint or hip. And then a pathology is pain in the inguinal area anterior to the hip, may indicate the hip pathology, and pain in the SI area during the application of testing, or during the application of overpressure may indicate SI joint pathology.
Okay, Mr. J, now we're on to the Glenson's test. So I'm going to ask my patient to position himself and lay supine. I'm going to ask him to bring his opposite leg up to his chest and hold. And then this leg is going to hang off. I'm going to apply pressure on his opposite leg and on his leg hanging off. Good, okay. And then a positive test of this would be pain in the SI region, and implications would be SI joint pathologies.
All right, Mr. J, so now we're doing the SI joint distraction and compression testing. So for this, I'm gonna have my patient lying supine on the table, and I'm going to have, I'm gonna put both hands on the ASIS joints. I'm just going to be pressing down, and that is for distraction. And then for the compression test, I'm going to have my patient laying on the side, and I'm going to place my hands here, just push down like so. A positive test would be pain arising from the SI joint, and then the implications is sacroiliac pathology. All right, Mr. J, so this is going to be the spring test for posterior to anterior joint play. So I'm going to have my patient lying prone on the table, and I'm going to be standing up, and I'm going to apply pressure to the spinous processes. And a positive test for this would be the vertebra does not move or spring, the vertebra moves excessively, and then the pathology would be lumbar segmental hypomobility or hypermobility.
Okay, Mr. J, so now we're on to the Adams forward bent test. So I'm going to ask my patient to stand there. I'm going to ask him to bend over and touch his toes and run his legs across his body. I will be sitting, and I will be examining his spine. Run my fingers up through. Okay, then you can stand up. I didn't see any scoliosis signs there. And then I looked at his lines on his back, and I didn't see any implications of bending there either. A positive test would be a asymmetrical hump is observed along the lateral aspect of the thoracolumbar spine and rib cage, and then scoliosis would be present but then disappears during flexion, and that is the pathology or implication.
All right, so now we're on to the Hoover's test, or the malingering test. So I'm going to have my patient laying supine on the table, and then I'm going to be at the foot of the table cupping each ankle. I'm going to lift it up, and I'm going to ask my patient to raise the leg on the affected side. Okay. And then a positive test for this would be the patient does not attempt to lift the leg, and the examiner does not sense pressure from the uninvolved leg pressing down on the hand, as that should instinctively happen. And then implications is the patient is not attempting to perform the test. This is pretty much for people who are faking an injury. So, yeah. But I think that's it, right?
Yep.
Yeah. All right. Well,
Thank you, Mr. J.
Thank you. That's it. And we'll see you next year.